like Amy said, public health's kind of like you want to look at it from every lens possible, and it's kind of a balancing act. We know that with all these businesses being closed, it's put a strain financially and mentally on many people. And while we want to open up businesses, we want to also keep the spread of the COVID-19 at a minimum. It's a very difficult task, but I think going forward, our main goal is to do a good job. I'm going to be going over some of the guidance that the state has released as we go towards the yellow phase, and I'm going to share my screen. Can everyone see my screen?
Yep.
Okay. All right. So a little backstory. Last Friday, the state was supposed to release guidance for the yellow phase, and it never came to fruition. And then on Monday, we were expecting this guidance early in the morning, and we didn't get it until late in the afternoon or early evening on Monday. And that is this document right here. It's 7 pages. That's pretty much what I'm going to be basing my presentation off of. And I will say that things are rapidly changing and evolving. This is a very non-static event. As I was doing my PowerPoint, I got some information in this morning, and we're still trying to acquire some information. We were expecting something more than 7 pages from the state, a little more detailed. It kind of leaves a lot of gray areas, might have more questions than answers, but I'm going to do my best to explain what the state has released. So, business reopening strategy, how to plan for a safe restart. Slideshow. Like I said, I'm David George at the Erie County Department of Health. So the table of contents, first I'm going to go over some background information with you regarding COVID-19, how it's spread, just some basic information that you all may probably already know, but it's always good to have a refresher on this. And then an intro into the code yellow phase. I'm going to go over some of the state policy, how to protect employees, how to protect the public, their requirements for communication, and then some frequently asked questions. So a little background information. So the virus name is SARS-CoV-2, and SARS stands for Severe Acute Respiratory Syndrome. It's related to the SARS outbreak that happened in 2003 genetically, but the disease that it caused is very different from than that 2003 outbreak. The disease name is coronavirus disease 2019. 2019 is from the year that it was found, and that's abbreviated to COVID-19. The corona stands for crown, and you can see that it's kind of based off this image, the little spikes. They kind of adhere to your lungs and they affect your respiratory system. I'm not exactly a doctor, but I know from my understanding is that the crown-like structures are what make it more unique. The flu molecule is more of a ball shape, so this is a relatively new novel virus. The common signs of the disease are respiratory symptoms, fever, cough, and shortness of breath. And you need to know these symptoms because you need to screen your employees as they come to work. That's what you need to ask them. How are you feeling? Have you shown any signs of respiratory symptoms, fever, cough, shortness of breath? You need to ask everyone entering the building those questions. More severe cases have pneumonia-like symptoms, kidney failure, and as we know, it can result in death. How is it spread? It's spread from respiratory droplets. It can be ingested through the eyes, nose, and mouth, and a droplet transmission by close contact. That's why we want to maintain 6 feet of separation between individuals. The science on this is relatively new. It's getting updated constantly. At first, it was believed to be able to live on surfaces for 3 to 7 days. More recently, I think the time frame is shortened from 24 to 48 hours, but it can live on surfaces, which is why cleaning and disinfection is very important. And it can be transmitted through infected individuals, even if they are asymptomatic. That's one of the hardest, most difficult things to deal with, because you could completely not have any symptoms and be able to spread it. And like I said, not too much is known about that. I know there's a lot of studies on perhaps more people are infected than we think, but I'm no expert on the medical side of that, but that's just some basic background information. And I also was going to go over the difference between isolation and quarantine. We seem to get that question quite often. So isolation is a sick person with COVID-19 is separated from people who are not sick to avoid spreading illness. And then quarantine is a person who has been exposed to someone who has COVID-19 and is at home to limit community exposure. We usually ask people to quarantine if they have been in contact with someone who is known or a confirmed COVID-19 patient. And that usually will involve, you will be in contact with the health department. We have a very good contact tracing team at the Erie County Department of Health, working constantly. And that's one of the reasons why in Erie County our case numbers so low, because of that contact tracing. It's kind of like a web. So if someone were to test positive, we would contact that person and from the previous 48 hours, see who they were in contact with and talk to them. And one person could have had many contacts within the past 48 hours. And the definition of close contact is within 6 feet for about 10 minutes. So that's the difference between isolation and quarantine. And the numbers, this is of 11:11 a.m. yesterday. As we all know, in the world, over 3 million cases. The US has the largest with over 1 million cases. The state of Pennsylvania has 52,816. And like I said, these numbers are from yesterday at 11:11. They're probably higher now. I think Erie's still at 93. I don't think there was a new confirmed case. Recovered, not all states are tracking the recovery rate. Pennsylvania, we have no data, but in Erie, 67 people have recovered from this. And then deaths, in the US, there's close to 70,000 deaths. So it's a pretty, 3 million people have it worldwide. It's still growing. And I was looking at, all these numbers are from the Johns Hopkins interactive map. And I was looking at the trends. And right now it looks like we are flattening the curve. We still have a lot of cases each day, but we're not increasing exponentially like we used to. But it looks like we're on the peak of the curve in the United States, which still means each day there's a lot of new cases. And we want to keep it that way. And also we just want to go on the decline. And what everyone's worried about is opening up, going into phase yellow will lead to an increase in cases, and that's not what we want. We just want to have this on the decline. So now I'm going to go for an introduction to the code yellow phase, which begins on Friday, May 8th. Here are the counties of Pennsylvania that have been deemed in the code yellow phase. Includes Erie. I think we're probably the most populous county in this code yellow phase. So we're going to be one of the first in the state to implement the new soft opening of the businesses. There were some criteria that the state looked at to go to phase yellow, and that's fewer than 50 new confirmed cases per 100,000 population in the previous 14 days. So I did some digging into this. So the Erie County, as of 2010 census, had about 280,000 people living in it. And from that would mean we would have to have 140 cases in the previous 14 days, which is an average of 10 a day. We have been well below that average. I think the highest we've had in a day is 7. But if the virus were to spread again, there's definitely the potential that we could go back to code red. So say we have 10 confirmed cases each day for 14 days, I believe we would go back to phase red or code red if that were to happen. Also, say one day we just had a huge outbreak of, I don't know, 70 cases in one day. I hope it never happens, but then that really, for the previous 14 days, that for the next 13, we'd only need 70 also. So we really want to keep this number below the average of 10 a day. And we don't want any huge spikes. It wouldn't be good for businesses. It wouldn't be good for hospitals. Wouldn't be good for the health department. So we really want to keep this number low by doing these environmental or these mitigation efforts. And then there's other metrics that they used for code yellow. This includes enough testing for individuals with symptoms and target populations, including the elderly, robust case investigation in place, which we have here in Erie County at the Department of Health, and the identification of high-risk areas. And so we know some of the nursing homes, the areas that might be more, the risk is higher for exposure to the COVID-19. Those are some of the other metrics that the state has used to deem us in this code yellow, along with all the other counties that are yellow on the screen. And then there's no sign of green, so red, yellow, green. I have not heard any updates on when we are going to green. We have gotten that question asked a few times, but as soon as we know, we'll try to share that information. So under code yellow, there are certain businesses that are not allowed open. Those include personal care services, which are gyms, spas, hair salons, nail salons, massage therapy, and entertainment such as casinos, theaters, amusement parks, and arcades. So that leaves a lot of gray areas, a lot of room for interpretation. And just yesterday, I had the Mill Creek Mall as a gray area. This morning, we got confirmation that the Mill Creek Mall, only the external stores can open, such as the Boscov's, the JCPenney, and the Macy's, but none of the internal stores where you can only access the store from inside the mall can be open. And my understanding is that these stores on the external will have a guard at the gate to the mall. The gate will be locked. However, if there's a fire and it needs to be opened up, the guard will open that gate. Hopefully that won't happen, but that just came out at about 10 o'clock this morning. I learned of the Mill Creek Mall. And like I said, we're unsure about when the green phase will begin. I don't even know if the state knows that. They're probably just going to see how the yellow phase goes first and make a decision based off of that. So the state policy, this is going off of that guidance that they released on Monday, late afternoon. First and foremost, businesses that have been operating remotely through telework must continue to do so until orders are fully lifted, or the green phase. So if you're working remotely, like Erie Insurance, you should continue to work remotely when possible. But with that being said, all businesses in the yellow phase are permitted to conduct in-person operations, except for those on the previous slide, the gyms, spas, hair salons, entertainment, casinos, as long as they strictly adhere to the guidance. Businesses that maintain in-person operations must make their employees and customers aware of the efforts and commitments to protecting their health and safety. So it is up to the business to make sure that both their employees and the customer are well aware of the policies that are being put in place. This can be posting signs on the premise, on the entrance, having social distancing marking on the ground, at least 6 feet apart. At the health department, we have X's on the ground, about 6.5 feet apart for when we enter for the temperature screening. And also the implementation of a pandemic safety officer. I'll discuss more about that in a few later slides. Businesses are required to publicly acknowledge their responsibility to ensure the health and safety of employees. So the state is putting some of the onus on the businesses to responsibly open up because it would be impossible here. We have over 1,600 licensed food facilities that we're familiar with working with, but I mean, the amount of businesses in Erie County, I'm not even sure. It's large. We're working with lawn and garden centers, golf courses, notaries, businesses we have never worked with in the past. And to go to every single business would just be impossible to make sure that they're abiding by all these rules. So it's the state is putting the responsibility on the business to come up with a plan to open in as safe a manner as possible. So what should the business do? They should protect employees and protect the customers. And I'm going to go over the cleaning protocol to protect the employees first. And in the guidance released by the state, it says owners of buildings greater than 50,000 square feet. This should be done by all the buildings, even if they're smaller than 50,000 square feet. It's just highly recommended to maintain these best practices, and that is clean and disinfect high-touched areas routinely. Ensure the facility has a sufficient number of employees to clean, and ensure the facility has sufficient number of security employees to control access point. If you take a look at the picture here, this is the Gabe's, the entrance to the store. There's a employee there making sure that they can control the amount of people in the store. There's cleaning, some disinfection product, and she's wiping down all the carts as the customers return them before a new customer takes them. So cleaning and disinfection is very important to help prevent the spread of COVID-19. So protecting employees, like I said, routinely clean and disinfect workstations, keyboards, telephones, handrails, and doorknobs. At the health department, we have hired a cleaning staff to come in, and every morning they clean those high-touched areas, including the doorknobs, the doors, the handrails. Clean your cell phone also with a little a disinfection wipe. I don't know, it was brought to my attention how many germs can accumulate on your cell phone. You use it everywhere, you can take it everywhere. So wipe that down often, and also don't share your phones, desks, or tools with other workers. That's one way that the virus could potentially spread. So just be aware of that. And if you do have some common tools, just wipe down the equipment before you pass it off to your coworker. And it's also important to clean and disinfect if something's really dirty. Clean using soap and water, let it dry off, and then you can disinfect. Most common disinfections are approved by the EPA, and they are efficient. And then it's the employer's responsibility to provide some disposable wipes and clean commonly used surfaces. I provided a link for some frequently asked questions regarding this. That's where I got most of this information. Businesses can provide tissues, no-touch disposable receptacles, soap and water in the workplace, place hand sanitizers in multiple locations, posters that encourage hand hygiene. There's a lot of guidance out there that you can reference to abide by these rules. So cleaning is one of the most important aspects to help prevent the spread of COVID-19. And then protecting employees. A very important part of the whole process is you need to plan for a confirmed case of COVID-19. You need to put a plan. If, God forbid, one of your employees were to test positive for COVID-19, a plan needs to be in place. And first and foremost, if that were to happen, you need to close off the areas that where the infected person worked, and wait at least 24 hours before cleaning and disinfecting the area. And then also need to clean and disinfect all shared areas. If this were to happen, the health department would be in contact with you to inform you of the confirmed case. And then also once that occurs, you need to identify employees who were in close contact with the infected person, which the definition by the state for close contact is 6 feet for about 10 minutes. And then also, this is important, taking each employee's temperature before they enter the business. This only has to occur if you have a confirmed positive case for COVID-19. We're getting a lot of questions about this. You do not need to take every employee's temperature if you have not had a case. It's recommended, highly recommended, that you screen the employees, ask them how they're feeling. If you're able to take their temperature, you can, but it is not required unless you have a positive case. So we highly recommend taking temperatures, screening employees, but it's only required, the temperature part is only required if there is a positive case. Inform the employee that if they have any symptoms, to inform their supervisor and go home. Like I said, shortness of breath, fever, cough, sore throat. Every day when we go into the health department, there's a screener. She asks us those questions: shortness of breath, fever, cough, sore throat, just to be extra cautious. If you have those, it's recommended that you stay at home. And then advise sick employees to follow the CDC recommended steps. And the state also encourages to implement liberal paid time off. And I know there's a lot of people are asking questions about where to find a temperature gun. And there's a supply chain issue there, like a lot of other things with disinfection, masks, temperature. It can be difficult to find those. So it's recommended that you go to the business-to-business exchange for the DEC ED's website. That's probably your best bet to find someone who will be able to sell you the temperature gun. So not required unless you have a positive case, but highly, highly recommended if you are capable to take temperatures and definitely do the screening. Just ask everyone how they feel. Shortness of breath, fever, cough, sore throat. And then protecting employees. So that was pretty much the protocol. You need to have a plan in place for worst case scenario. What if someone were to come down with the COVID-19? So some mitigation efforts to prevent this is stagger work start and stop times. So don't have everyone come in at 8 o'clock. If you can spread out the start times, like between 7:30, 8:30, if you're able to do that, please do it. And limit the number of people in a common area. Make sure that they're 6 feet spread apart. Make sure if it's a break room, have a sign saying only 3 or 4 people allowed in here at once, depending on the square footage. Conduct meetings and trainings virtually when and if possible. And if you must have an in-person meeting, you should limit it to 10 people or less and maintain social distancing. Provide employees with access to soap, hand sanitizer, disinfection wipes. That goes back to the cleaning steps. Cleaning is a very important part of mitigating the spread of COVID-19, and to provide non-medical masks for employees to wear. I'll go over that in more detail later. the difference between the types of masks, but masks are essential. Discourage non-essential visitors from entering the premise, and try to have, if you have a business, do it by appointment only. Try to have people come in by appointment. If you're not able to do that, I'll go over that a little bit more and how to prevent the public or keep the public safe. But this is pretty much regarding protecting the employees. And the most important thing probably is to communicate these procedures to all the employees to ensure everyone knows how to be safe. Maybe just have a brief Zoom meeting with your employees. It can be 10 minutes long. Used to call them tailgate meetings, did them every Monday. Just make sure everyone's on the same page. If you tell everyone the same thing over and over, they're sure to remember it. They might get annoyed with you, but as long as this is in the mindset, safety first, that should be the number one goal for all the employees, just to do their job in a safe way. If we can do this and keep the spread of the COVID-19 low, like I said, below 10 cases per day, hopefully way lower, that's the whole goal. There is a slight worry that on May 8th, with everything opening up, this might all go, or we might just have an explosion, and that's what we're trying to prevent. And in order to do that, we need to abide by these rules as best as we can. All right, so that's how you protect the employees. And now I'm moving on to protecting the public. So businesses that serve the public inside a building. Conduct businesses by appointment only, like I said, when possible. Or if you cannot do that, the goal would be to limit the number of people inside a building to no more than 50% of the total max capacity. I did some digging into that. I think if a building was made after 2002, 2003, somewhere in there, there is a max occupancy of that building. I don't know if it's your township that would have that information or the BIU, but for example, here at Gabe's, it says the total number of people that can enter is 140, and that's a little small to, whoops. It's about, their limit is 2 feet per 2 people per 1,000 square feet. But what the state says is half of the total max occupancy. So if you're allowed to have 200 people in your building, no more than 100. Pretty straightforward. You just modify hours to ensure time to clean and restock if needed. Install shields or other barriers at register to physically separate cashiers and customers. A lot of the grocery stores have implemented this now. Wegmans and the Giant Eagle, they've been doing a very good job. We've been in contact with them at implementing all these procedures. And encourage online ordering by providing delivery or pickup options. Designate a specific time for high-risk people. A lot of the grocery stores have early in the morning a pickup time from 7 to 8 for elderly or high-risk populations, and then require all customers to wear a mask except for people with a medical condition. That's extremely important. We're doing a pretty good job here in Erie County of abiding by this rule. And then as an employer, to really enforce that all customers need to wear a mask. It's almost like no shoes, no shirt, no mask, no service. Kind of put it along the lines of those or that. If someone's not wearing a mask, just, I know we don't want any confrontation, but just kindly ask them and then if they aren't wearing a mask, try to help them out. If you can do the online ordering or delivery, offer them a solution, try to work with them so they don't have to enter the store. Maybe you can get the goods that they need and just deliver it to them, but try to offer them an alternative if they are unable to wear a mask. And then use every other register. So if the registers are numbered, it would be 2, 4, 6, and then every hour switch and use registers 1, 3, 5, and really wipe down the registers in between those hour uses, and also and assign an employee to wipe down carts. If someone's done with the cart, someone should be there just wiping it down, just to make sure that in between the use, someone is cleaning the cart before the next customer grabs it. That goes for carts and hand baskets. And then the requirement for communication. This is the responsibility of the business to conduct their operation to ensure the health and safety of the employees and the customers. So the businesses must print, sign, and post the COVID-19 safety procedures for businesses. There's a couple different versions of this. There's an 8.5 by 11 folder or size, and there's also an 8.5 by 14 PDF. So if I click that, it'll bring me to the COVID-19 safety procedures. So this should be signed and posted on the premises at the entrance so that the public is easily able to see it, and also so that your employees can see it. So in like the break room, and it needs to be signed by management and posted. And every business needs to do this. Like I said, post in an employee common space and near the entrance for public view. The business must also designate a pandemic safety officer or person in charge for ensuring all COVID-19 safety procedures are carried out. We've gotten a lot of questions about this. One, for chains, it's okay if there's one large pandemic safety officer for all the Taco Bells in the area or all the stores in an area, but I would encourage that each store has a safety officer underneath the entire district or regional pandemic safety officer. And their main responsibility would be just ensuring that all these guidelines are abided by. Because if you only have one safety officer, if he's not in the building, things will probably get a little lax. That's why it's always good to have one person in charge, reminding everyone to maintain their social distancing, disinfect everything, ensure that all the customers are wearing a mask, and do it in a friendly manner, not trying to just say, hey, you're not wearing a mask, get out, but just, sir, you need to wear a mask. If you can't, is there anything we can do? Can we deliver the goods to your car or deliver them to your house? Just try to be accommodating. And do not send this flyer to the state or to the local department. Simply keep it on your premises. You don't need to mail it, email it out. You just need a plan. You just need to sign the flyer, and along with the plan for what to do with if someone were to get the COVID-19 virus. You need a plan, but you don't need to send it to the state. You only need to have it on hand if someone were to come and request to see it. You need to have a physical copy at the location to show. There it is again. I think this is in a couple different languages as well on the state's website. And here's some masks, some frequently asked questions. Scarves, bandanas, and other coverings will suffice. Employers are required to provide masks, and I know there's a supply shortage of masks, and so there's a lot of information in there on how to make homemade masks using sewing machines, bandanas, but if you don't have one, like I said, scarves. And then if you don't have a mask, a disposable face shield would suffice in lieu of a mask. There are some reasons why a worker would not need to wear a mask. If it impedes their their vision, have a medical condition, and creates an unsafe condition, then they're not required to wear a mask. But it's highly encouraged. that if barring those three things, that the customer and your employees wear masks. And like I said, businesses should deal with maskless customers like they would someone without shirt or shoes. And then there's some facts about masks and some other frequently asked questions about what businesses should and should not do. And then at the health department, we've been working very close with the Department of Community and Economic Development. We've submitted multiple questions to them regarding very specific industries. We learned that funerals can take place with a maximum of 25 people. Hair salons are not permitted. They can only sell their retail product, but no haircuts, no manicures, no pedicures. For golf, 2 people from the same household may share a cart. That's relatively new information. Churches, we kind of have no jurisdiction over this, but they're strongly urged to follow all guidance and limit gatherings to 25 people or less. And we're still waiting for guidance from the DCED on outdoor sports, soup kitchens, elective dental and eye procedures, swimming pools, Airbnb. We just got some information this morning, actually. Update: short-term rentals are allowed if they follow all the guidance that I kind of went over today. And we're also waiting on the zoo. So there's a lot of gray areas. We're working very closely with the state. I wouldn't be surprised if we have some answers by Friday in 2 days, but since we're probably the most populous county going into Code Yellow, I know the county executive has communication with the governor, and there's a close eye on this county right now, and we want to do a good job because it's almost like we're going to be a microscope for the state just to see how we do, and which is why it's very important that we abide by this guidance so we can keep the numbers low. Like I said, we want to average less than 10 a day, and we do not, to prevent going back into code red, which is a possibility. Here's a couple signs of some good practices at a golf course: just to go only, call ahead, and at the right it was a coffee shop. Really promoting call ahead, and if there's more than 2 people inside the door, to wait outside. We really want to promote social distancing, and I remember from the beginning, first and foremost, if you're able to work remotely or telecommunicate, that's the most important thing. Do that if at all possible, but if not, really abide by the guidance that I went over today. And here's my contact information. If you have any questions, you can call me at 814-451-6778. And that's my email address. You can shoot me an email and I'll try to answer it. But like I said, we don't have all the answers. If we don't know the answer to the question, if we don't know the answer to your question, we'll forward it along to the state and try to get back to you in a timely manner. We're trying to respond to as many questions, concerns, complaints as possible. There's a lot going on, but like I said, we're trying to do it in a timely manner. And finally, the stay-at-home order is extended till May 8th. That's when everything's going to happen. And the most important thing is to continue: wash your hands, wash your hands, wash your hands. Don't touch your face, and wear a mask. Wear a mask. I think if we do those, it will definitely lead to keeping the virus contained. Wash your hands, wear a face mask, and that's it. I think I saw some questions.
Yes, we do have questions. Thank you, David. Okay, so we're going to get through as many of these as we possibly can. I think some of these you kind of covered a little bit in the presentation, but I think just, clarifying or driving home the key points. So the first question that we got is related to Liability. So what is the liability for businesses with COVID-19 tracing? We can put safety precautions in place, but are also dependent on the responsibility of others to stay home if they're contagious. Could a business be held liable if it's linked to COVID-19 tracing?
That's a good question. I'm not on the legal side of all the COVID-19. I, I don't have the answer, but I can definitely look into the business liability. Um, I don't know if there's been any cases in the past or in other states where they've been sued, but yeah, it's out of our expertise. It'd be a good idea to consult a lawyer on that.
Yeah. And I think that's a question that we've been getting at the chamber a lot as well. So I actually have been in touch with a couple of local attorneys to see if there's enough information available yet to do some sort of presentation or webinar on that topic. So stay tuned for more information on that. Next question is, has any information been received to date on the number of people permitted in a business at one time? Is it, I know you said it's based on sort of half the official occupancy. Is there any additional guidance on that?
We do. There is one question. That half the occupancy does it include both the public and the employees, or is it one or the other? That is one of the questions that we did ask to the DCED. But as of right now, it's just that 50% building occupancy. And to my understanding, before 2003, 2004, your building might not have that. You might want to talk to your municipal zoning officer or the BIU. I don't exactly know how they come up with that number. I think it's based off square footage and the number of entrances and exits available. But that's something you definitely want to try to find out, the total occupancy, and just cut it in half and don't exceed that.
Okay. Are employees supposed to wear masks at all times in an office or manufacturing setting where they're not regularly interfacing with the general public if they're spaced at least 6 feet apart?
It's highly recommended, like I said, to wear a mask unless it impedes your vision, you have a medical condition, or can create an unsafe thing. However, if you're in your own office and no one else really comes in there, you're kind of separated by some walls or cubicles, and it'd be all right to relax that a little bit. As soon as you're out in common areas, like if you're in a space that's your space and no one really comes in there, then you don't have to wear it. But it's always encouraged to clean everything frequently. But as soon as, like, for example, in my office, I don't wear a mask. If someone pokes their head in, I put my mask on. Or if I leave my office to go to the bathroom or go visit someone else, I put my mask on. So if it's your space, I would say no. But any communal space or any sort of near distancing, definitely wear a mask.
Okay. Next question is, and this may be a long answer, but how do businesses that function with large groups of people, such as sporting teams, start to plan for the future and the impact of social distancing?
We have a question about outdoor sports, indoor sports. We submitted that to the DCED, and I know with the code yellow, the guidance is 25 people or less. And for anything greater than that, I would imagine that would be the green phase that's going to come into the future. But sports are not allowed under the yellow order per Secretary Levine. So I think that's going to be coming in the green phase. So I think more information will come. We just got to get through the yellow phase before that happens.
Sure. Are wine tastings permitted, provided social distancing can be maintained? If they're conducted outdoors, and I'll stop there. There's a second part to the question, but so are wine tastings permitted, provided social distancing can be maintained?
I would say no, just based off of restaurants, eating and drinking establishments are carry out or delivery or takeout. So there should be no mingling on the premises. It should just be you buy your wine and you go, or get it delivered. So, but I'll look into that. But that it's not, like I said, there's a lot of gray areas. But right now, I'd say I don't think that's allowed, just because that might attract more people. And yeah, with restaurants and eating and drinking establishments, it's carry out or delivery. So I'll definitely get some more information on that.
And then the second part of that question is related to outdoor events. So I think because this is wine tasting, in the same question, this is a winery asking if outdoor concerts can be scheduled, provided that social distancing can be maintained.
That sounds like it would be permissible in code green, but there's no mass gatherings allowed, and that the general term that was not allowed under the code yellow guidance was entertainment. Concerts are a form of entertainment, so I'd say that those are not permissible in the code yellow.
Sure.
They could lead to mass gatherings.
Makes sense. Let me see here. How do you enforce rules in an outdoor environment like a campground, for example? Do we assume any liability for not enforcing CDC guidelines?
The liability, you would have to ask your lawyer. But campgrounds are encouraged to rope off any sort of communal picnic areas, clean and disinfect the bathrooms, remove chairs and tables. Most campgrounds we've talked to have been doing this, and most people just go to camp and they go in their RV, and they pretty much just stay in their RV. We're doing a lot of education at this point. Like I said, it's hard to enforce all the businesses within the county. And a lot of it involves the cooperation of the businesses to enforce these policies.
Sure. This question is coming from a manufacturer, it sounds like. If we have protocol in place to clean touch points on machines after each shift, does that eliminate the need for masks while on shift standing at their workstations?
If that were to impede their vision or cause a safety hazard, then yes. But if depending on the social distancing of the machine or how far away the machines are, it's highly encouraged to wear a mask. But like I said, there's a lot of vision and safety factors that go into that, and then a lot of it is kind of common sense. If you're far away from each other or blocked off, a mask wouldn't be required. But it's definitely encouraged when possible to wear a mask.
Next question is, what is the list of questions that anyone entering our building must be asked?
So at the health department, it's those 4 symptoms, which are shortness of breath, cough, fever, or sore throat. Just pretty much general well-being. That's what you're asked before you enter the building. If there's, yes, I have some of these symptoms, it's advised that you send the person home until they feel better. Just as a precaution, they might not have COVID-19, they might just have the common cold, but just to be extra careful, just to prevent the widespread of the disease.
I think an area that's caused a lot of confusion for people is that difference between screening and testing. We're getting a lot of businesses asking if they have to test their employees before they come into the building or return to work. So could you just touch on the difference between when we say screening versus testing?
So screening is just the question, just basic questions. How do you feel? And then testing is actually going to your primary care provider and getting the COVID-19 test, the lab panels done. So screening I guess it's maybe kind of similar to quarantine, isolate, but yeah, screening isn't testing specifically for COVID-19. It's just kind of a general, how do you feel? If you have any sort of symptoms, just to go home. And then if you do have these symptoms, say you went through the screening process and you said, oh, I got a sore throat and a shortness of breath, and then you go home, it's best to self-monitor for a few days. If things are getting worse instead of better, to call your primary care physician and in order to get a test done. I know our nursing staff would have a lot more information on that than me, so you could always talk to them with regard to the when you should get a test done.
Okay. There was a question, you used the example of grocery stores that have the, screens or plexiglass shields between the cashier and the customer. So obviously grocery stores have very high customer volume. Does a small business that maybe only has, a couple of customers at a time, do they need to have shields in place at their counters as well?
According to the guidance, yes, it should be required, but any sort of, if you can't get the high tech barriers that the grocery stores have, you can almost do like a makeshift barrier, maybe like a cardboard cutout or just something, so there is some sort of physical barrier. With these, a lot of people have gotten very creative on how they can abide by the rules. It doesn't have to be, like I said, some sort of very fancy barrier, but just get creative, try to create some sort of barrier so there's a protection between you and the customer. And after each customer, it would be wise just to disinfect everything, where the card reader is, the cash register. Just take as many precautions as possible after dealing with a customer if there isn't a great barrier in between the customer and the employee.
What would the recommendation be for a small business that has restrooms on the premises? They were available for public use. However, would it be best to close them off to the public while in the yellow phase?
Restrooms should be cleaned and disinfected routinely, almost hourly or every other hour. If not many people use it, almost after any time someone were to use it, it's recommended that someone go in and just clean the restroom. If you want, you could lock the restroom and keep the key up behind the counter. That way, if someone has to use it, they have to ask for the key. You give them the key. When they return the key that someone's used the restroom, and you can clean it before the next person uses it. So I think that would be the best practice to use.
Next question is, I'm wondering what the recommendation would be for someone who's having a difficult time getting their employer to adapt all of the guidelines.
Just an educational, just try to talk to them. We've had a lot of employees in the past just call the health department and say, hey, do I have to go to work? This isn't happening. So if it gets real bad, just call the health department and put in a complaint, and we'll call and try to address that. If it's real bad, we've been making some site visits, but a lot of this is just educational. I would say to tell them, kind of give a rundown of the presentation that I just gave and the importance of code yellow. Say, hey, if we're not in code yellow, if we see a spike in numbers, we might go back to code red. And then it's just in everyone's benefit to abide by all these rules, not just from a safety perspective, but also the business aspect of, we want to keep going. We want to progress to the green phase. So just try to convey the message as best possible.
Sure. And to that point, I think also I've been recording today's session, so I would encourage you to share the link to the recorded presentation. We'll also be distributing the slides after the presentation today as well, so feel free to share that information with them. I think a lot of this too comes from the fact that there's just so much information and so much to be conscientious of that it may be overwhelming for the business owner to try to implement all of this stuff. So I think this presentation is a great place to start as far as breaking it down in an easily digestible manner. Okay, so last question. Do you think, oh, just kidding. Second to last question. Do you think a financial institution needs to clean surfaces in between every customer or member that comes in, or would cleaning every hour be sufficient?
Um, it's recommended to clean between each customer. The guidelines specifically say, if I recall correctly, to clean frequently touched areas routinely. Yeah, clean frequently touched areas routinely. So if routinely is an hour, if it's like really busy and it's just not feasible to clean in between each customer, do it at least an hour. That's how the guidance says. But if you can clean between each customer, um, do it. Financial institutions, they can implement the drive-through ATM or the the teller, if possible, just to try to limit those interactions as much as possible, and really encourage online banking or electronic notarization. There's been a lot of due to this pandemic, there's been a lot of innovation in electronic telecommunication, so there will be some good that does come of this. But yeah, so it's a, yeah, clean, frequently touched surfaces routinely. That's as frequently as possible.
And then the last question is just related to, you mentioned that the Mill Creek Mall external stores are going to be permitted to open. Was there a date shared on that?
May 8th, I
May 8th.
believe.
Okay.
When we go to code yellow, only the yellow, or only the external stores are allowed to open on May 8th, not the internal stores. And like I said, that information came out about an hour or two ago. And information is always coming in. This is always changing. It's a little difficult. We're just trying to absorb as much information as possible and help the public as much as we can to help prevent the spread of the virus. And I know we're doing a really good job in Erie, and I just want to thank all the business owners who've been doing their part, because this is all up to everybody to and to abide by. So the Department of Health also wants to thank all the people, all the businesses, all the customers who are taking this seriously. And I think that's part of the reason why the numbers in Erie County are so low. And we just want to continue to see that.
Great. Well, thank you so much, David. This was really helpful. We appreciate you taking the time out of what I'm sure is an incredibly busy schedule right now to share this information with us. And just a reminder to everyone else that's left on the webinar, please feel free to share the replay link and the slides that we're going to send out here within the next few hours with anyone that you think would benefit from this information. We want to try to get as much information out as possible to help businesses navigate all the changes that are going to have to take place. And we certainly understand that there are a lot of questions and there's a lot of gray area right now. So we're certainly very thankful for the health department's help in getting us the most up-to-date information as quickly as they have it. They've done a really remarkable job, especially to this point as things change so quickly. So we're certainly very thankful for that. So with that said, that concludes our session for today. Thank you all for joining. Thank you, David, again, for your support and your presentation. And stay healthy. And if you have questions, we'll make sure we provide contact information in the follow-up email. Thanks, everyone.
I just added my email and phone number to the chat box in case someone missed it from the presentation. So yeah, if anyone has any questions, just feel free to call me, email, and I'll do my best to get back to you in a timely manner.
Wonderful. Thank you so much, David, and thank you, everyone. Have a great day.
Thanks.